This is Uprising. I'm Sonali Kolhatkar. Now, you can now watch the TV version of Uprising on Free Speech TV, which is available on DirecTV and Dish Network as well as Roku. If you don't have access to any of that, check out our YouTube channel. We're at youtube.com/Uprising with Sonali. We are just under 100 subscribers away from our goal of 1,000, so we hope you'll subscribe today. Again, that's youtube.com/Uprising with Sonali. In yet another legal challenge to the Affordable Care Act, the Supreme Court decided last month to hear the case King versus Burwell. At the heart of the case is what may simply be sloppy wording in one sentence of the original bill, which became President Obama's signature law. Essentially, he has now written the law offers subsidies to low-income Americans who purchase health insurance on a state-run exchange, such as Covered California. But because 36 states opted not to run their own health insurance exchanges, primarily because of Republican governors' opposition, millions of Americans have bought their plans through the federal health exchange, healthcare.gov. The nation's highest court will now decide whether those Americans are eligible to receive subsidies, thereby undermining the entire basis of what both supporters and detractors refer to as Obamacare. Joining me in studio today is Paul Song. He is a radiation oncologist and also on the board of Physicians for a National Health Program and People for the American Way. He's also the executive chairman of the Courage Campaign. Welcome to Uprising, Paul.
Thank you for having me.
Welcome back. You've been on our program before to talk about Obamacare, quote unquote, and I know that you are both a critic of it from the left and also a supporter because it is something that the right doesn't want and better than nothing. So let's talk about what's at the heart of this latest legal challenge. And I should say the Supreme Court has already taken up the Affordable Care Act, declared it constitutional. This happened 2 years ago, but this latest case is centered around Section 1311, which is, as it's written now, based on subsidies. And it just so happens that it says those subsidies are for a nonprofit entity or government agency that is established by a state. Did the people who drafted the law really mean to say that only in cases that people got their health insurance through the state would they get subsidies, and that if they bought it in the federal marketplace they wouldn't get subsidies? Did they mean that?
Well, it's hard to say what the intent was, except that I think when this was drafted, I don't think they ever anticipated that all these governors would line up and say that they wouldn't, set up an exchange in their own states. So it's really, we're looking at the people that are between 138% and 400% of the federal poverty level. Those are the people that would qualify for a subsidy. And in those states where the Republican governors have essentially refused that, technically that is the question of this lawsuit, that in those states, because it says the subsidies would go to people and exchanges only set up in states, not by the federal government, that's where you've had this real disagreement. So you had the D.C. Federal Circuit Court say that absolutely this is not applicable. And they overturned it, and they said this should, that the plaintiff should win. And then you had immediately after, several hours later, a court in Richmond saying that no, that wasn't the intent. That reality is whether it's a federal or state that should all apply under the Affordable Care Act. This is going to be the real issue of the Supreme Court.
And it's interesting because if the Supreme Court were to rule in favor of the plaintiffs in this case, it would essentially amount to discrimination, right? Class discrimination based on where one lives, which state one lives in. And how can that be constitutional, although
we're seeing that with the Medicaid expansion as well.
Yeah.
But what's really ironic is, so the gentleman that brought this forward, he has an annual salary of $20,000 a year. He has a flooring company, and he was basically saying that if he decided not to participate, that the individual mandate would basically mandate that he would have to pay a penalty of $100 a year. Or if he had signed up for the exchange, we're talking about he would only have to pay $18 a month for full health care coverage. And so based on that, you had a lot of people that were much more powerful and have a lot more money that were basically saying, okay, we'll fund this lawsuit to basically get our point across, that it really comes down to the wording.
So because there's a mandate that everybody get health insurance as part of this law, and there are subsidies to help people get them, this person is saying, I should be able to choose not to get them. The subsidies are helping me too much, and I don't want to be helped, because he is saying that he is more concerned about federal taxpayers and deficit. I mean, this sounds basically like the Tea Party.
It really is. And here is somebody, again, that in the past, by his own admission, could not afford health insurance. And he's saying that the individual mandate makes it he would have to buy something he couldn't afford. That 8% of his salary is something that he couldn't afford, but he doesn't realize that with the subsidies, he would only have to pay $18 a month, which is really a couple boxes of cigarettes a month that he could defer and end up having health care.